this is an issue that every dentist faces every day of their practice. The topic of my presentation is the structural analysis of the posterior teeth, which is a very important topic in my opinion, because once a tooth gets interrupted mechanically in any way, meaning that it either gets drilled into or it has some kind of a decay, caries, or any kind of crack according to trauma or because of trauma, that means that the original mechanical structure, the biomechanical structure is interrupted. Therefore, the tooth is losing the original capability of fulfilling its masticatory function. When we are dealing with these situations, it is really important to understand how we are able to diagnose what is happening exactly with the biomechanics of the tooth, where the intervention happened, where did we lose tooth structure, and according to that, how are we able to understand how this affects the whole function of the tooth. In my lecture, I'm going to go into detail about the different types of diagnostics possible to obtain in a clinical practice, every clinical practice, basically on a daily basis, in order to diagnose mechanical aspects of posterior teeth and understand how we can successfully restore these. The presentation will cover the topic of the biomechanical analysis of posterior teeth. More closely, we will try to get in and understand what happens when we structurally compromise a tooth, either by drilling or by having secondary or primary decay. Once we are able to see these situations clinically, we will be able to measure and understand what are possibilities from a restorative standpoint, what are the possibilities to restore these teeth in a way which is not only aesthetic, but functionally sound. So this is what we would call a biomimetic way of restoring teeth. The topic is important because every day when we are making restorations into our teeth, we are dealing with biomechanical compromise. If we are not equipped with the diagnostic tools and the restorative tools to deal with biomechanical compromise and restore these teeth in a way that they will be structurally sound, just like the natural tooth is, then we will ultimately end up with failing restorations. These restorations will fail via secondary decay. They will fail via fractures, so catastrophic or non-catastrophic restorable fractures. And this is an issue that every dentist faces every day of their practice, either with their own restorations or restorations made by a third party. So I think it is one of the most important things to understand. And if someone is able to grasp the concept of diagnosing teeth from a structural standpoint, then they will surely have a much more successful daily practice.